You see, we learned a lot about managing COVID patients. You know, our first wave was truly disheartening because it was sort of a new disease that we had to deal with. And our therapeutic options were pretty limited.
Dr. Giovanni Ciuffo wasn't used to working with intensive care unit staff.
Intensive care unit specialists don't interface much with a heart surgeon, but that became a necessity.
That necessity began when the first wave of COVID-19 hit Siouxland, and doctors had to use everything at their disposal to save lives.
It's a modular cooler, heater cooler. Basically, it circulates water through these pipes and it controls the temperature in the patient.
Doctors turn to an external oxygenation device, something cardiologists typically use for patients who suffered cardiac issues.
You can hook it up to the machine and dial the machine and say, bring the patient back to a normal body temperature, 98, 99.
This machine can essentially oxygenate your blood for you, something many otherwise healthy people were struggling to do after testing positive for COVID-19 and ending up in the ICU, fighting for their lives.
This is the console that controls the functions of the pump.
When the MercyOne team first began using this machine to treat COVID-19 positive patients, they were among the first in the nation to do so, but they worked in cooperation with other hospitals nationwide, finding a new way to care for patients with this unknown virus.
You can see there's an oxygen tank here, and in addition to that, there's an oxygen regulator. You see the air oxygen mixer. And we can basically modulate how much oxygen is put through the oxygenator while the machine flows so that I can control the patient temperature, how much I'm flowing.
This machine takes your blood, oxygenates it, gives it back, allowing your body a chance to heal.
And this one, most importantly, let's say you had to transfer the patient out to a transplant center. You can actually take just this module.
The oxygenator is used to help those who have suffered a massive heart attack, pulmonary embolism or blood clots, and those whose heart has stopped because they got too cold. This machine can bring their temperature back up and bring them back to life.
So this one is basically what will keep a patient alive and well while they go into the next level of treatment if it's available to them.
While the outcomes were initially unknown when treating COVID-positive patients, they saw positive results.
In medicine, you always have to strike a balance between what's reasonable to help someone and what's just far-fetched. In those patients that we used this machine on, really, it was not far-fetched. They survived. So it was well worth all the effort we put on it.
At MercyOne Siouxland Medical Center, Katie Copple reporting.